On today's episode of the Holistic Savage podcast.
Every month, estrogen, estradiol, and progesterone follow a very specific path, or at least it should, ideally. And while it might feel like a roller coaster, the roller coaster should go up and down in a predictable pattern. As women enter into their 40s, though, although it can start as early as their late 30s, that roller coaster can start to go off the rails. And it may go off the rails some months and then come back on the rails. Other months, they may go a few months in a row where it feels off the rails, and eventually over time, they just feel like everything's off the rails. It's not a controlled roller coaster.
All right, functional friends, you are in for an amazing treat today. I have my good friend, Dr. Carrie Jones, on for the third time to the Holistic Savage podcast. Carrie Jones, how are you doing today?
I am doing well, Brendan. I'm so happy to be back on, and I'm glad you're doing this again.
I am too. Yeah, it's been, every episode I can't help myself because it's like this, it's a resurgence, a resuscitation of an old show, right? The original Holistic Savage podcast, we had definitely some of the absolute best minds in the functional medicine, holistic health space, you included, I think twice so far. But this is really a new and improved show, professional production, everything's just better, got sponsors on board. So it's a big deal. But of course, I was very eager to bring the one and only Carrie Jones back on for an amazing conversation about all things related to, we'll see where we go with it. I mean, I'm sure we're probably going to cover a lot of ground in a short amount of time. But maybe to kind of kickstart the convo, I'd love to hear maybe some updates that you want to share with the audience of like, what's the focus in Carrie Jones's world these days? What lights you up? What is your passionate purpose these days? Where are we at?
Where are we at? Actually, one of the big things that's lighting me up, mostly because it's pretty personal, but it is very, let's say, popular or trendy on social media, is the topic of just perimenopause and menopause at large. And that's just an area that I am finding so fascinating, given all the research that is finally now coming out about this transition and about these hormones, and the original study that freaked everybody out 20 years ago called the Women's Health Initiative, how that has largely been debunked. And unfortunately, the misinformation is still out there. But if you think about it, half the population is going to be in perimenopause and menopause. So if roughly half the population are women, and then there's that huge percent getting older and moving through there. And then once you're in menopause, depending on your health and longevity, you're there for a good third to a half of your life. And so doing it as healthy as possible, thriving, I think, is the new turning point for a lot of education out there on social media. I know I'm seeing it, and I really like to see it to just really help people be their best as they get older.
I think I would agree. I feel like I'm seeing more and more just information coming out. Obviously, I follow you pretty closely, so I've been seeing you talk more and more about it. And I liked the conversation we were having last week with Dr. Nicole Berkins, and even just the 15 minutes of dialogue we had, I'm like, this is big. I think we need to talk about this a lot more, because we do have this aging population in general. And of course, a lot of conversations centered around the chronic disease crisis and chronic inflammation. But to me, what stood out in that dialogue we had last week was just how this is a very understudied, kind of overlooked demographic, and it's a growing demographic within the United States and world. And especially these days with the explosion of, hormone replacement is bigger than ever, anti-aging medicine, peptides, all of these things. I think people are more and more, 40s like the new 20, and it's all about how do we thrive into those later ages. So I'd be really curious to maybe start diving in of, what do you think is driving some of the major sort of perimenopausal hormonal shifts and disruptions? On previous episodes, we've talked about things like PCOS and HPA axis, but I'd love to hear almost from kind of that inflammaging, immunosenescence, perimenopause sort of perspective of why are so many more women really all of a sudden, getting to their late 40s and they're struggling so much harder with gnarly symptoms, lab values are changing without any sort of reasonable explanation. What do you think some of the big driving factors with this is?
Just looking at perimenopause, that actual perimenopausal transition in itself, it's the change up in hormones. So if we think of the women's menstrual cycle, think about being on a very controlled roller coaster every month. Every month, estrogen, estradiol, and progesterone follow a very specific path, or at least it should, ideally. And while it might feel like a roller coaster, the roller coaster should go up and down in a predictable pattern. As women enter into their 40s, though, although it can start as early as their late 30s, but on average, they're in their 40s, that roller coaster can start to go off the rails. And it may go off the rails some months and then come back on the rails. Other months, they may go a few months in a row where it feels off the rails. And eventually over time, they just feel like everything's off the rails. It's not a controlled roller coaster. And by that, I mean, as women get into perimenopause, that hormone progesterone generally declines. It's one of the first hormones to go down. So you had all these milligram levels of progesterone coursing through your body for half of your cycle, and then it goes down to less than 1 milligram, like a very, very low amount. And that can affect everything from sleep, to mood, to your periods, just everything. Then as we continue to transition through the perimenopausal time frame, estrogen just decides to become wild child. I mean, it's like reverse puberty. It's up, it's down, it's up again, it's up more than it's down more than it's up. Eventually, it sort of peters out. The ovaries they close shop. They don't want to do this anymore. They don't want to produce estrogen like they were. And then estrogens drop as well. So that transition period where they're feeling kind of wild and crazy, not in a good way, is because of this shift in all the hormones that are happening. And as you brought up a number of symptoms that women can have, I don't think a lot of education goes around that the change in these hormones affect all body systems. If we assume we have 12 systems in the body, all 12 of them are affected in this transition. Now, does this mean it's the end of the world? Is this like worst case scenario? Absolutely not. No, but you do need to realize that what you've been doing, or that you think you might be crazy, or, oh my gosh, what has changed? This is the physiology education part of it. Now we layer on top of that modern society as a full-blown umbrella option. Modern society. Our stress is often higher than ever. Our diets are not that great. Our soils are pretty poor. Environmental toxicants suck. The list goes on. And so when you're going through this transition and you layer on the 21st century, it creates, for a lot of women, a really hard time with this transition. So by just understanding that part, now we can peel back the layers and go, okay, but what can we do? Like, how can we help this? Whereas before, 10 years ago, 15, 20 years ago, this education wasn't really out there. And so a lot of women were coming into their 40s and felt like they slammed into it. And nobody told them, and their OBGYN wasn't that educated on it, or their gynecologist or their GP, their general practitioner was saying, oh yeah, this is normal for this age, good luck. And everyone felt blind and lost and hurt and freaking out. And now that is pivoting, where more and more women are getting more educated to at least understand what's happening in their body. They're not crazy and they don't have to put up with it. Thank goodness.
This episode is brought to you by DHA Laboratory. Whether you are a self-healer trying to get to the root of your chronic health complaints, or a functional practitioner looking to provide your clients or patients with the best lab testing available, DHA is your one-stop shop for all your lab testing needs. DHA offers self-healers the ability to order a wide range of lab testing to empower their self-healing journey with actionable data, while providing practitioners a consolidated lab test ordering experience to cut down on the hassle of ordering many tests from many separate labs. DHA Laboratory is also a pioneer in advancing the research of cryptopyral disorder, a commonly overlooked root cause factor in a myriad of mental health disorders. DHA is also the exclusive provider of the Mental Map, which is a cutting-edge lab panel that I personally designed to help self-healers and practitioners get to the root causes of their mental health struggles using the most clinically significant and relevant biomarkers available. Be sure to use the link in my show notes to learn more about DHA Laboratory to up-level your self-healing journey or functional practice today. This episode is brought to you by Genova Diagnostics. Genova Diagnostics is a leader in functional lab testing to help functional practitioners and self-healers get to the root causes of their chronic health complaints. Genova offers a comprehensive menu of lab testing, and some of my favorites include the GI-FX stool test that combines multiple technologies to thoroughly assess GI function and microbiome health, the metabolomics that assesses for many physiological and biochemical systems related to nutrient status, methylation function, detoxification and toxic exposure, microbiome health and dysbiosis, and much more. I also love their methylation panel, which thoroughly assesses methylation-related SNPs and methylation biomarkers reflective of current methylation status. I think it's very important if we're trying to test MTHFR and methylation health. We can't just look at the SNPs by themselves. We also have to measure these clinical biomarkers. So this is one of my favorite panels to effectively assess for methylation. I've been using these Genova diagnostic tests in my practice with great success for years, and I'm very excited to be able to offer my audience direct access to these valuable self-healing tools. So you can actually visit the Genova Diagnostics link in the show notes and use code Holistic Savage, that's all caps, no spaces, Holistic Savage, to get you a discount and get direct access to these practitioner panels. You know, in the age of information and in this kind of wacky virtual world that we live in, it is cool though. There's pros and cons, of course, but I do like that because we all have access to the same internet and social media being what it is, all these different platforms, and it's giving a voice to demographics that traditionally are just not really heard or talked about. I think there's a lot of benefit of that, and I could cite a lot of different examples of that. But it's good to actually now we're looking at these problems that have probably existed forever because, you know, to me, I can't help but wonder a little bit of like, let's say 100 years ago, you know, were women going through, was it a smoother transition, you know, or were they suffering just as much as kind of modern women? It's just now we're hearing more about it. We're getting more data about it because to your point, you know, certainly all of us in the functional medicine and holistic health space, we recognize the modern stressors of modern society, the high speed and the stress. And we could certainly talk for hours just about how stress is wrecking us or the environmental toxicants, so on and so forth. And something, whereas, I don't know, even just over the course of my 15-year career so far, hormone replacement therapy has exploded, right? And I do a lot of consulting with people that, you know, might be interested in hormone replacement because I'm sure you can appreciate this. I think all the, you know, Dutch testing and hormone testing and kind of natural hormone modulation and the DIM and sulforaphane and HPA adaptogens, I definitely see that, you know, even with all the holistic intervention, people still want more. I think a lot of people struggle to kind of get sort of the hormone balance, the hormone resolution, the endocrine symptom reduction that they want simply through trying to change some of their, because it's almost like it's such an overwhelming barrage of modern stressors on the endocrine system that it's like, I don't know that popping a few botanicals is going to quite do it. So I'd be really curious of what's your stance on HRT and hormone replacement and that industry, because to me, I feel like there's, I don't want to say more HRT peddlers than ever, but there are, you know, I think hormone replacement is kind of an art, but I'm just curious your perspective on that of, do you feel like, you know, hormone replacement really is the answer and the solution, or is this kind of another, I don't know, you know, pill for the ill type of ideology?
Well, to answer the part in the beginning, menopause, the actual term menopause was coined in the 1800s. So they've known about this for a long time. In fact, I believe like the earliest record of women getting older and things going to hell was with Aristotle. Like they've got writings of like, what the heck is going on with these women? And so it was, we've known this for a while, which of course they didn't have the 21st century on them back then. It was a lot of different things, but we've known, you know, when women lose or these hormones decline, the ovaries shut down, that it absolutely can affect all the symptoms. Mental health being a big one. So when you see the early writings, you see, oh, these women are hysterical. what's going on with them, admitting them, let's give them mental health medication, because we don't understand that it's actually menopause and the decline in estradiol that plays such a big role in this. So now we fast forward with hormone therapy as an option, and I am a huge fan of hormone therapy. However, the caveat is hormone therapy by itself is not a magic wand. If you lead a lifestyle that is putting you on a direct course to cardiometabolic disease, hormone therapy by itself is not going to course correct that. If you are choosing not to exercise, your macros are maybe really imbalanced to tons of sugar, tons of caffeine, tons of alcohol, a lot of stress in your life, you're not sleeping that well, and then you think, oh, you know what? I'm going to go on hormone therapy and it will fix it. It's a part of the entire foundational project for that woman. We still have to address all the foundational work. You still have to get the lifestyle dialed in. Now, let's say you're listening to this and you go, no, but that's me. That's me, Carrie. I work out. I lift weights. I manage my stress. I try to be in bed sleeping by 10. I've actually cut out alcohol because it gets in the way of my sleep and makes me feel terrible now that I've gotten older. All the things, and I'm still having symptoms. Like, oh my gosh, you're the perfect person if you're a fit for hormone therapy, because it will be the missing piece of the puzzle to then further improve your symptoms, further help you to thrive. So while it is not like I said, a magic bullet all on its own, it can be wildly helpful for women who are, quote, doing all the things. And the missing piece is their estradiol is quite low, their progesterone is quite low, their testosterone is quite low, DHEA, et cetera. And we forget, what doesn't get talked about is, again, everything around menopause is around reproduction, right? Oh, you're menopausal, your periods have stopped, you can't get pregnant anymore, that chapter is closed in your life, whether you wanted to or not. What doesn't get discussed are the other 11 systems that are 100% can be affected by this change in the hormones. So the brain health, the cardio health, the metabolic health, the bone health, like those are the big things that I worry about. It's not breast cancer that kills women, it's heart disease, right? Heart disease is the number one killer of humans. Now, do I worry? Am I concerned about breast cancer in general for women? Of course. But what I want them to be concerned about is cardiometabolic disease. I want them to be concerned about, let's protect your brain, because that's why you're struggling with a lot of these symptoms you have, hot flashes, night sweats, mood changes, memory issues. All that starts in the brain, believe it or not. And so if we can support that, then they're going to have a much easier time as they're getting older through their 5th, 6th, 7th, 8th, 9th decade. I say all the time, my family lives a long time. My family easily lives, when I look at my grandparents and my great-grandparents, into their 90s. And so I plan to do it thriving. Like, I plan to be traveling. I want to be able to lift a suitcase over my head. I want to be able to pick up grandkids. Like, I want to be on cruise ships. I want to be doing all those things. I don't want to live into my 90s and have osteoporosis and dementia and be on 14 medications because of my heart disease. And I want women educated on this now. I want them listening to this now going, oh my gosh, I'm in my 30s, or maybe I'm in my 40s. That gives me 4 decades, 5 decades to work on this. Heck yeah, let's do it.
I love that. I love that. That was a very beautiful, full, eloquent, synopsis there. And so to kind of speak to 3 separate points there with hormone replacement, I love the way you pose that of, obviously, like, let's optimize your metabolic machinery, your endocrine pathways, and whether it's hormones or peptides or pharmaceuticals or psychedelics, right? It's all about, let's get your meat suit ready to best receive and utilize the medicine, right? It makes me think of, I might have said this to you on our last podcast, I don't know, but I had this personal training client years ago at a private studio over there, and he was a very conventional cardiologist. And, this guy trained with me like 3 days a week, and he only ever wanted to do bench press. I would force him to do leg day. He did not want to do leg day. He wanted to do bench press to pump up his ego, fill out the white coat, right? And at one point, he was doing androgel, like a topical, testosterone. And he was like, yeah, I did this androgel, but, it was giving me like, man boobs and making me really tired and all of that. And I'm like, okay, so you're a doctor, you're a medical doctor, a cardiologist, and you're not familiar with like aromatization. Like I'm a knuckle dragging personal trainer with a PhD in bro science, and I could tell you all about aromatization, right? So a good example of, we have to be obviously using the lifestyle and the environmental, the functional interventions, so that way your body is best utilizing, absorbing, metabolizing, processing the HRT, simply hoping HRT is going to be a silver bullet. And, the monitoring, right? Because it's like you could be pumping full of, this one hormone, but if it's not in balance with the others, and you know this better than anybody, of the synchronistic effects of getting that hormone cocktail just right. And just to then, just to finish the HRT point, I'd be curious from you, because there's so many different delivery methods, right? There's pellets, there's injections. I think the troche is kind of the way to go, but what do you think about the delivery methods with trying to have, stability and consistency so you're not all over the place?
Well, there are different tons of forms, right? So, and it depends which hormone that you are talking about. So,
Mm,
in general, the guideline is we don't do oral estrogen. So we don't swallow it as an option. So the troche or the troche, which is the sublingual under the tongue against the gum kind, if you have estrogen in there, just be aware you are swallowing some of it. There is a teeny tiny increased risk for clotting, heart stuff. Less risk in a sublingual than there is in an actual capsule. But pretend you're sucking on an Altoid, a mint or something. You are swallowing your saliva, which clearly has mint flavored stuff in there, and down it goes into your body, and that's how it can act orally as opposed to the sublingually, just because that's the route it goes. However, progesterone, testosterone, DHEA even, people sometimes will choose to do, of course, orally, or they'll get it compounded as a troche or sublingually. With estrogen, we tend to do topically. So we do it topically. The prescription is the patch that you can apply, get at a regular pharmacy, or you can have it compounded as a cream. You can do it topically, vaginally. I mean, there are a lot of options for that. Whereas progesterone, you can also do same thing. You can get it compounded as a cream. There are, of course, over-the-counter progesterone creams. You can get it compounded or is a vaginal cream. Like there's all of these options, which is what I want the takeaway to be is there's no perfect route. There's no perfect way. It depends on the person. It depends on what outcome they're looking for. For example, oral progesterone, you swallow a progesterone pill, seems to help the most with sleep, feeling calm, and lowering anxiety. Well, if that's not your issue and you don't like swallowing pills, then I'm like, I'm not going to give you that. We're going to go a different route for progesterone. But let's say you still have children at home, and you want topical, you want to rub it on your hands or your arms, you want to, rub it on your body. You don't want to swallow pills, you don't want to do vaginal, you don't like injections, and you surely don't like pellets, because these are all the feedback I get from patients over the years. But you have young children at home still, which is totally possible with women in their 40s. When you rub it on your skin, you have to be very careful of transference. You don't want to rub it on your skin and then turn around and hug your partner or hug your kids, or even smear it on your animals. Animals can pick it up as well. So we take all of this into account. If you're afraid of needles, we can't do needles. Injections are out. Pellets, I am not pellet trained. I'm not a very good person to talk about pellets. Pellets are teeny tiny rice size implants full of hormone that go on your hip, on the side of your hip or booty. And they last about 3 to 4 months. Usually my friends who insert pellets or train in pellets don't start with a pellet. If you've never done hormone replacement before, they start you into hormones elsewhere, make sure it's a good fit, everything's right, and then they move into pellets. Because once the pellet's in, it can't come out. So if you get the pellet in, you have a negative reaction, we have to manage the reaction. We can't go in there, unfortunately, and dig it out 2 weeks later because you don't like it. Once it's in, it's a commitment. So I want people to understand there's no perfect route. Some are commercially available, like at a Walgreens, CVS, Kroger, Costco. Some can be compounded. Some are over the counter. And it honestly depends on your age, your situation, your preference, your fears, those sort of things. And then we piece it together from there.
hmm Perfect answer. And when it comes to monitoring, which I think is absolutely critical, like I usually will recommend, monitoring values in the blood and urine, so we kind of get both sides. Do you have a preference or perspective on the monitoring and frequency and form?
So the good thing is, interestingly enough, to diagnose if somebody is perimenopausal or even menopausal, you don't have to do any blood work or testing whatsoever. It's symptom, age, and then of course, period related to are you having periods or not. To go on hormones, you also do not need to do any kind of blood work or testing whatsoever. So if you are feeling all the symptoms and you see a doctor who says, yeah, let's go ahead and put you on and chooses not to test, there's nothing wrong with them. The guideline says you do not have to actually get testing. Having said that, having worked in the hormone field a long time, I definitely found like tracking anything, cholesterol, thyroid, glucose, vitamin D, I like to see what the hormones are up to and where they're going. So I will usually test them before putting them on any kind of hormone therapy because I'm also testing them for other things. Thyroid is prone to change at this time. Cholesterol is prone to go up at this time. Glucose is prone to go up at this time. So I'm, all vitamin D, all the other markers I'm looking at, I'm going to add a few hormones in there as well if we're doing blood because I want to see what's going on. Now, the reason that testing can be controversial is because there's so many routes of administration. We don't have solid reference ranges on, hey, in the blood, oral progesterone should be this, but topical progesterone should be this, but pellet should be this. Now, you ideally be one reference range. It's like no matter what you take, your progesterone should go up, and here's the reference range. We don't really have that. That's not been well studied, and the pharmacokinetics of your progesterone in the blood with you swallow versus if you get it injected are different. So if you swallow hormones, it's generally in and out of the blood system in several hours. Versus if you have a patch or a pellet, it's a slow drip release. So the oral hormones you may not find in the blood work. Let's say you do your hormones at night before bed, and then you go to the lab at 8 a.m. You may find your lab results look scary low for hormones. It's nothing you did, it's the pharmacokinetic of the route you took. And so this is where we get into these nuances of testing. I am a big fan of testing, but I'm also aware of some of these issues that can happen.
This episode is brought to you by Microbiome Labs. I've been a raving fan of Microbiome Labs for many years now because of their cutting-edge research, novel microbiome solutions, and heartfelt culture. Many supplement companies exaggerate their product claims and have no research to back up what they say. Microbiome Labs, on the other hand, has up-leveled the entire functional medicine industry by modeling a research-first approach. Microbiome Labs has advanced the research of the human microbiome and offers many innovative tools to improve whole body health through the garden of life that is the microbiome, including the BiomeFX stool test and the Total Gut Restoration System. While I have used virtually all of their products successfully with my private clients, some of my favorite products include the Megaspore Biotic, their flagship product that is a multiple strain endospore probiotic that promotes microbial diversity, mucosal barrier and intestinal lining integrity, short-chain fatty acid production, and whole body health. I also love the Mega IgG 2000, which is pure serum bovine immunoglobulins that act as a defensive shield in the gut to bind and neutralize many pathogens and toxins, such as lipopolysaccharide, gluten proteins, mold toxins, exotoxins, microbial components, and so much more. I also love to use their Myomax, which is a specialized form of vitamin K2 that promotes mitochondrial function and energy production. It's actually clinically researched and shown to increase volume of oxygen or VO2, which is a very powerful indicator of cardiovascular fitness. Be sure to visit the Microbiome Labs link in my show notes to learn more and get your microbiome support today. This episode is brought to you by the Metabolic Solutions Research and Education Foundation, my personal 501c3 not-for-profit foundation that's dedicated to changing the way the world views mental health. I formed the Metabolic Solutions Institute Research and Education Foundation with the intention of providing the public with the education needed to empower their self-healing efforts, while concomitantly advancing the clinical research of mental and metabolic health disorders. As an independent entrepreneur with no investors or funding, I've chosen to launch a t-shirt fundraiser to raise money for the foundation. Clinical research is not cheap, and my hope is to sell apparel to raise brand awareness and funds so we can begin operations and serving those in need. The idea of the foundation is to put on public-facing educational events to raise money to then fund research and serve those in need struggling with their health. My vision is to have the ability to help those in need that do not have the funds to afford functional services, while collecting crucial data to advance the clinical research and in turn, use that research to better educate the public. I can't do it alone and I need your help. I'd love to invite you to support this worthy cause by ordering one of our awesome t-shirts or tank tops today through the link in my show notes. Please support research for mental health today. Yeah, I think there's a lot of different methods in trying to find that right cocktail, that right sort of regimen that's going to work. I mean, bioindividuality wins the day. And, a little bit ago, you mentioned the mental health, which I wanted to speak to because huge, right? And of course, me, that's kind of my whole thing. And you'll appreciate this a lot because I know you know me and the work that I do well enough because like the whole neuroinflammation stuff that I do and that neuroendocrine piece, right, is just so substantial because in some of the work and research I've been doing in recent years, I'll admit I'm more interested in neuroinflammation, neuroplasticity than endocrine balance and that's impact. However, you can't really be biased because you have to be looking at like, well, what's really affecting people. And what I keep seeing over and over, like, don't get me wrong, with Alzheimer's is what the 6th or 7th leading cause of death in the United States, and mental illness being what it is. Like, yes, there is a huge conversation to be had around neuroinflammation, but after screening like hundreds of people in recent years with my mental map test, and often also looking at hormones, I mean, what I see over and over and over is like every now and then I'll get somebody that they actually do have substantial measurable inflammation and neuroinflammation and glial activation and stuff. But it's way more common that those inflammatory immunological indices are actually normal within a very normal, low acceptable range, but their hormones are super messed up. And it would definitely on paper appear like, no, your mental symptomatology, your anxiety or depression and anhedonia is more endocrine driven than anything. And so I've been, going down some of these rabbit holes of like the PMDD and the allopregnanolone and all of that. But I'd love to hear you speak to, some of these hormonal shifts in perimenopause and how that can be very much driving the mental. And then we'll try to hit metabolic before I let you go for the day.
Yes. The mental piece, I think, is another hugely undereducated part of this perimenopausal transition. And I want to give a major shout out to the book, The Menopause Brain by Dr. Lisa Mosconi. I had the pleasure to interview her about 2 weeks ago, and we talked a lot about estrogen's role, progesterone's role in the brain. But we also need to talk about estrogen, for example's role in the GI tract. I mean, it's been shown, we know, as women transition into menopause, the decline in estrogen, progesterone as well, but really estrogen, estradiol, affects things like our tight junctions. So now we are prone to leaky gut. Our little gates that kept out the offenders from crossing into our bloodstream are gaping holes and letting everything slide through, and the immune system gets ticked. And of course, the vagus nerve's upset, and everything goes to the brain and is like, we have an issue here. There's all this inflammation. And it's all the stuff you talk about routinely. And she didn't do anything but transition into menopause, that this can happen on our GI tract. So focusing heavily on the GI tract to help the brain is a big one. Now, estradiol on its own helps make serotonin, and estradiol on its own helps support dopamine, and estradiol on its own supports oxytocin. So when women are feeling disconnected and anhedonic and like not interested anymore, they don't want to hang out with their friends, they're not loving their partner, and they're just like, what's wrong with me? I feel like a giant gray blob. There's nothing wrong with you. What's happening is you're doing this transition, these hormones have changed, and nobody told you. You didn't get a text message that was like, hey, so here's what's happening today. Sorry, we're not going to make estrogen today, so you're going to feel pretty low and blue and gray all day. best of luck. And if we could just get this education of like, all right, then how do we support serotonin? How do we support dopamine and other routes? If somebody chooses not to go the estrogen route, they don't want to do estrogen therapy, maybe they can't. There are other ways to support, as you educate all the time, on serotonin, dopamine, oxytocin, et cetera. Executive functioning, which is the frontal part of our brain. A lot of women going through the perimenopause transition say, who unplugged me? Why can I not multitask anymore? Why is my memory jumping all around? Why do I get overwhelmed with making big decisions? Why can I not keep things straight? Why can I not remember my neighbor's name who I've lived next to for 10 years? What is happening? I'm like, it's these big transitions. And so Dr. Mosconi talked about, think of it as like your brain is, on the one hand, getting leaner and meaner. It's getting rid of, speaking of neuroplasticity, it's getting rid of the pathways it no longer needs. You don't need to know to watch out for, small children. You don't need to know about how to breastfeed. You don't need to know some of the things around having a menstrual cycle anymore. That's getting rewired. But what you're wiring for as you move in that, just like anything, if you rewire something in your house, there's this transition point where your electricity's out, right? Like where the light switch doesn't work as you're rewiring your house. It's the same in the body. So you've got this transition point where the brain is like, I'm trying to get leaner and meaner. I'm moving out of one stage into another stage, but there's going to be gaps. There's going to be like that light switch isn't going to work for a couple hours, but it'll get there. Just hold on. And I love that she said that because it's the silver lining and we get to the other end. Oftentimes, a lot of women get those processes back. It's just unfortunately a couple years where we're like, are we going crazy? What is happening? But to understand that when you have serotonin, oxytocin, dopamine, GI inflammation talking to the brain, it does put you at risk for not only the executive function issues, but the mood. I've had so many women say, I don't understand. Turned 45 and I became more depressed. I became more anxious. I became less interested. I don't want to do this. I'm so negative. I have no patience. Carrie, I have no patience. I know this hormone change can really affect those things, but we can use lifestyle, nutrition, supplements, hormones. Like let's get this back while you're making this transition. Mm-hmm. Sometimes just knowing, oh, progesterone plays a big role in helping me not be anxious. Today is an anxious day. I must not have a lot of progesterone. What can we do to manage this? Sometimes just knowing can just take the weight off your shoulder that there's like, you're not crazy. This truly is happening.
Yeah. Oh, 1,000%. I feel like that has been one of my main sort of almost like the defining sort of narrative of my career with like when I was struggling with my mental health of there's no more defeating and hopeless of a feeling of like you just think there's something wrong with you. There's just something inherently wrong with you. You're broken. To have a tangible, objective, measurable, like physiological reason that explains, your suffering of like, oh, maybe it's not just me, then that empowers you to have an actionable solution. That in itself, like you said, the weight off your shoulders. And I remember, in the very beginning of my career, as a trainer and nutrition coach, and just I was super into, bodybuilding and fitness performance and all that stuff back then. And hormones were kind of one of my first like loves because I'm like, these do everything. They control so many aspects of your health. And, I was getting into hormones long before I knew anything about like this microbiome or neurotransmitters or any of that kind of stuff. Because, it starts with like cortisol and the HPA axis, and then you just sort of expand from there. I had Karan on the show like a week or two ago. So we were talking about endoaxis, and there's a reason why I'm bringing this up, I swear. That was it. So with, and you're going to go talk to them today. And I was wondering if you would, because, hearing a little bit more about, what they're doing with endoaxis, and it's so brilliant. Everything's going to go in that direction. But one of the things that we were discussing was, and you'll appreciate this because it makes me think of your lecture 2019 FDN conference in San Diego, like years ago, where, it's kind of this idea in the functional space, whereas conventional, kind of myopic and reductionistic. And then in the functional, we're so holistic of like, well, maybe this is the issue. And then the question is, how do we fix it? Because we can fix it from working on all of these other things. And so Karan and I were kind of discussing that of the idea being, even if you're trying to, like, let's say, fix the gut, you alluded to how estrogen can have this regulatory effect on the tight junctions. So then it's kind of one of those, wasn't that exciting? Because maybe like we can, sort of treat leaky gut, fix leaky gut by fixing, the estrogen, right? And that's kind of what I think EndoAxis is trying to, unwrap with data and AI, right? Is this idea of like, can we fix this issue by way of this system? Because in the functional space, we kind of like to try to attack it from all angles, hoping that there's enough crosstalk, there's enough sort of intra system signaling going on that if we do a little bit of this, a little bit of that, it'll fix all the issues. But I think, you're the perfect person to have that perspective with, the intricacies on all these different hormones. And to your point of how, hey, even if we just optimize your hormones, perimenopause, or get you on a proper HRT regimen, the mental, the metabolic, the gastro, all these different areas that can be positively impacted.
Well, I want to also point out, because some people will argue and say, well, if I'm becoming more leaky gut in this example, I will just treat my gut and then I don't need to or want to or have to go on any estrogen replacement, as an example.
Sure.
And when we're younger and cycling, we can absolutely work to get the cycle back. We can work to get, using a variety of options, estrogen back into its typical controlled roller coaster, right? Once she's into perimenopause through menopause, that all goes out the door. Because people will say, well, Carrie, I did a class last night. I had so many practitioners in it who said, what's the one herb that raises estradiol levels in menopausal women? None of them do. No herb will increase your estradiol levels. Some herbs act estrogenic, right? They're estrogenic-like genistein from soy. But none of them are going to go to your ovary and say, hey, girl, we need to turn back on and make more estrogen. And while there are some environmental toxicants that can increase aromatization, which can increase estrogen, once she's menopausal, her levels have dropped way, way down into the menopausal range. And first of all, we don't want environmental toxicants doing that. We don't even want them to begin with. But second of all, it's not enough to bring them back to their cycling levels. And so while I applaud the people who push back and say, well, then I will just support their gut, we have to remember they're in a major transition point. It's a reverse puberty. That estradiol is going down to a postmenopausal level and is not coming back unless you give them therapy on it. Now, when we look to optimize everything, we just include hormone, if it's a fit for them, as one of the pieces of the puzzle. I would never say don't optimize the gut, always optimize the gut, and consider estrogen as well if it fits for them. We also have to remember the symptoms that they don't feel. I have plenty of women who say, I never had a single symptom in menopause. I never had a hot flash in menopause. That's great, but cardiometabolic disease. Oh yeah, I have high blood pressure. I'm diabetic. I'm on 4 medications. I have all these issues. My joints always hurt. So people also seem to wrap their head around, menopause is hot flashes. And while a large percent do develop hot flashes, if you don't, it doesn't mean you've skated through free of menopause. Mm-hmm. There are over 100 symptoms of menopause, according to Andrea Donsky and her research team at Morphus. Over 100. And some we don't see. Most people don't know when their triglycerides have crept up to 150, 200, 300. Most people don't know when their lipids their cholesterol levels have crept up 250, 270, 300, 325 until they get that blood test. And then they go, oh crap, I thought I was doing really healthy and being really healthy. You lost estradiol. And that plays a big role in some of these things on the inside. It's playing a big role on things we just don't realize.
Yeah, I think it's extremely powerful. And I know you've got to get going soon, so I want to be respectful of your time. But even just thinking of, I can't help myself, because you've mentioned it, I think, a couple times, of the heart disease, right? Of course, heart disease is far ahead, number one leading cause of death for all Americans. But I think I wanted to highlight what you've mentioned a couple times, which is, heart disease is also really primarily what's killing women as well. And on the call with Nicole last week, when we were just chatting, and I'm sure we'll do another episode. I'll do an episode with her. It'll be great. Because what we were discussing about, the role of estrogen and its impact on endothelial nitric oxide synthase. And so we're thinking vascular tone, we're thinking oxygenation, perfusion, blood flow, and then obviously thinking of the implications of perimenopause and your estrogens crashing and how then that's down-regulating enos function and blood flow, increasing cardiovascular risk. I'd be curious to hear you elaborate on that cardiometabolic risk factor as we wrap up here.
It's a huge one that I don't want anyone to overlook. And as you, Nicole, and I were discussing last week, it's one that can change on a dime almost out of nowhere. I have had a number of quote unquote very healthy women I've been keeping track of, great numbers, everything's feeling great. And all of a sudden we run numbers and I go, oh gosh, your glucose is over 100 all of a sudden. Your lipids are really climbing. Oh gosh, your blood pressure is getting, like, you're in that pre-hypertension area. What changed? Oh, your age. And it can be diet, lifestyle, stress, alcohol. I mean, those things absolutely play a role, but let's pretend the person listening is going, no, Carrie, I didn't change anything. I haven't changed anything. But because on the inside, the ovaries are changing, their enos is changing, their ability, their insulin resistance is changing, getting worse. Their ability to recycle and use and handle cholesterol is changing. Now on the lab work, this is why lab work is so important to see, because some of those changes they may not notice. They may not feel their blood pressure creeping up. They may notice they've gained some weight, but they don't realize it's the visceral fat. It's that inflammatory fat causing a ruckus around their organs. They don't realize they become pre-diabetic or maybe even diabetic until they get that blood work. And I think because it can change almost seemingly on a dime, my last bit of advice is if you haven't had a workup in a while for the cardiometabolic stuff, it's time to do it. And don't think just because you had it done last year, if you are in this age range, that it may be different this year. Don't think, oh, last year was so good. I was so good. I was deserved a star. It went in my fridge. I tell you, this year it may be different. We want to keep a tight eye on it. I don't want anyone to have cardiometabolic disease if we can prevent it.
Yeah, absolutely. I'm sure we could go on, and we'll do another episode. I'll get you back on, in the coming months. But I think that was actually an extremely powerful and succinct conversation around perimenopause, the implications of a lot of really good information in a short amount of time on testing, therapeutic strategies, holistic strategies. So more than anything, I'm just very grateful for your continued friendship, the fact that we've been friends for over 6 years at this point, third podcast on this show, and we'll do it again. So I really appreciate your time, my friend.
Oh my gosh. Well, thank you for having me on. I always appreciate hanging out with you.
Yeah, it's always a lot of fun. I look forward to our next conference that we didn't find one in Q2 yet, but I'm sure as the year goes on, we'll find a way. Cool. Enjoy the rest of your day, my friend. We'll talk soon.
You too.
Bye. Thanks for listening to the Holistic Savage podcast. This is a Wellness Out Loud production produced by Drake Peterson and edited and mixed by Mike Fry. As always, if you liked this episode, please rate it and review it on your podcast app. Don't forget to subscribe and share with your friends. See you next time. This podcast is for general informational purposes only. It does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.